Reduce your stroke risk. ABCs of stroke prevention. The Chinese saying, to treat the disease, the best is to prevent the disease from happening, and I would like to give some ABCs of how to prevent a stroke. That means by reducing the risk of stroke. And let's start with A, meaning alcohol. While a small consumption may be beneficial, a moderate to large amount of consumption would increase his stroke risk. A also stands for atrial fibrillation, that means irregular heartbeat. If you feel that you have palpitation, your heart beating fast, irregular, or have a big thump, that's when you have to bring this to your physician's attention. B stands for blood pressure, and that's the number one risk of strokes. If you are able to lower your blood pressure to a level of 120/80, I know you may have been told a higher level ID okay, but 120/80 is the latest recommendation. You will reduce your stroke risk by 40%. C stands for cholesterol. We all know that cholesterol is bad, and high cholesterol increase stroke. Of the cholesterol subgroups, the LDL is the most important. Remember the limit of 100, but if you belong to high risk group, the limit is 70. D stands for two things. Number one is diabetes mellitus. If you have diabetes, it's very important that you should have it checked and treated by your physician and have your blood sugar controlled tightly. The second D is favorite diet. You all know that you should eat healthy, appropriate in amount, fresh fruits, vegetables, and minimal amount of meat, and avoid the fry food, the fatty food. E is probably the most important thing you can do for yourself, and that stands for exercise. The recommendation says that you should exercise a minimum of 45 minutes a day and a minimum of 5 days a week. And what I like to tell the patients is, if you are doing exercise to begin with, why don't you do it more than 45 minutes? Why don't you go to an hour or more if you enjoy it? And if you are doing it, why don't you do it every day? F stands for the thing we don't want to think, and that's fat. And we measure fatness not by the BMI, rather by the abdominal girth. And for woman, it's 32 inches and above you are fat, and for man 40 inches abdominal girth. So try so as much as you can. Follow this ABCs. I can assure you, the risk of your stroke would be less. The best way to treat a stroke is to prevent. Know your blood pressure. Pay attention to heart rhythm. Quit smoking. Drink alcohol in moderation. Control your blood sugar. Cut salt and fat from your diet. Have your cholesterol tested. Exercise. Please give me a favor by subscribing my YouTube channel, SDK Online Teaching Institute.